Now for a topic that's everyone's favourite, we're going to do the tracts of the spinal cord. And we can divide them into ascending tracts and descending tracts. Now there are many, and they are quite variably divided, and this has changed a lot in the last half century. What we're going to go is the three top clinically important ones that you need to know. So the first one we'll do is called the DCML, the dorsal column medial lemniscus system, and by movie magic, how beautiful is that? The second one is the spinothalamic tract. Technically there's two, but don't worry about it. And the next one is the spinocerebellar tract. In terms of descending, the big ones I'm going to give you are the corticospinal tract. There's also a corticobulbar tract, which is the face. Then we have got the lateral vestibulospinal tract. This is a nice important one. And we can make a distinction between a ventral and a lateral corticospinal tract, which we won't mention too much here, but that can be important. Again, this is just an overarch. There's a lot more to it than this, but basically there's not much else that a doctor needs to know unless they're going into neurology. So let's draw where these things are. If this is ventral, this is dorsal. This is a cross-section for the spinal cord. And it will be an upper cervical region cross-section. We're going to first of all draw our dorsal funiculi with the gracile fasciculus and then the cuneate fasciculus. So your gracile fasciculus, which means slender, and your cuneate fasciculus, which means wedge-shaped, because it's wedged between this dorsal horn and the gracile fasciculus. Right, the next one that we'll do is we will bring on the spinocerebellar tract. Again, there's a few, but they all sort of coalesce here. And it's bilateral, of course, so there's one on this side, there's one on the other side as well. So this is the rough approximation for where we'll find our spinocerebellar tracts. And then just here, adjacent to the ventral horn, is our spinothalamic tract. Now, how about our motor systems? So corticospinal's out here, our lateral corticospinal's out here, our ventral corticospinal's here, and our lateral vestibulospinal's here. So this is important because you're going to be asked questions based on lesions, right? So Brown-Séquard syndrome, tabula dorsalis, classic ALS symptoms, anterior spinal, posterior spinal arteries, a whole load of different things. If you have this rough idea of where the tracts are, you will be fine in sort of being able to piece it together. So that's a brief overview of the names of the tracts, and I'm going to do videos on them now. So there we are.